to SugarBeat. SugarBeat is the official social media platform of Gets Pharma Philippines Cardio-Metabolic line. SugarBeat aims to provide relevant and timely information on the prevention and management of diabetes and high blood pressure. All page contents are designed for every Filipino to embrace the value of wellness and self-care.
Good evening, sugar beaters. Welcome to our Friday-Serye. Tonight, we'll talk about proper guidelines on self-medication versus medical consultation, from real to real talk. To introduce our speaker, she is a diplomate in family medicine. She is currently practicing as family medicine consultant on the following: City Health Unit in Macoyan, Bulacan, HMI Care Clinic Inc. and Tagaytay Medical Center. She had her residency in Our Lady of Fatima University Medical Center, and a graduate of College of Medicine in Our Lady of Fatima University. Sugar beaters, let us all welcome Dr. Carolina I. Fernandez.
Good day, everyone. I am Dr. Carolina Ipapo Fernandez. Welcome to SugarBeat PH, and I'm going to talk about self-medication versus medical consultation, a real-to-real talk. And we're going to correlate this with diabetes mellitus and hypertension. Now, for our objectives is first to define the self-medication versus medical consultation, to clarify the basic procedures in a medical doctor's consultation, to determine factors leading to self-medication, to identify potential risks of self-medication by patients with illnesses like diabetes mellitus and hypertension, and lastly, to establish steps in preventing potential risks with self-medication. So now, what is self-medication all about? Self-medication as defined is taking of any drugs, herbs, or any home remedies on one's own initiative or on the advice of another. Kasama na po dito ang tinatawag nating kapamilya, kapatid, kapitbahay, kaopisina, and of course, ang pinaka-famous na si Dr. Google or the social media. And what is medical consultation all about? It is when a patient goes to a registered doctor or a medical practitioner for his or her expertise regarding a certain illnesses or disease for evaluation and management. For the steps in medical consultation, first, vital signs must be taken. Kasama po dito yung blood pressure, body temperature, heart rate, respiratory rate, pain, and even the height and weight for us to know or to get the BMI or the body mass index. This is followed by history taking. This includes family history, past medical history, present history, OB/GYN history for the girls, and etc. Next is the physical examination and laboratory procedures. The laboratory procedures are not necessary. However, if there's a need to ask for it or to be requested, ginagawa naman po ito. Also, for the confirmation of the diagnosis or impression given by the medical practitioner. What are the factors that could lead to self-medication? First is the urge of self-care. Siyempre, no, it is just but normal for us to love ourselves. Like, during the pandemic, there are a lot of people who really don't want to go to the hospital. Why? Because of the fear na baka mamaya mahawa pa sila doon ng COVID-19 infection. So, they opted to just self-medicate rather than go to the hospital and get infected. Next is family. Siyempre, ikaw, kapamilya mo, nakikita mo, nanghihirapan, naglalagnan. So, rather than go to a medical doctor to have an appointment, ikaw na mismo nagbibigay. O, ito na lang gamot, inumin mo na lang. So, it is considered as self-medication already. Next is the lack of time. During this time, nasa fast pace po tayo lahat. So, gusto natin lahat mabilisan. And again, sabi nga natin, minsan, sa medical consultation, we still need to have an appointment. Gusto mo matapos na, magamot ka na, to get over with. So, yun po yung nangyayari. And then, of course, availability of drugs other than drugstores. Again, social media is a very big factor regarding this. Kasi nandiyan na po yung mga online shopping, online ordering, online delivery, of even medications as well. Next is the education. Since nga, hindi naman po tayo lahat ay nasa medical profession, we really don't know what is our illness all about. No? Society. So ito, minsan may mga stigma dito eh. Minsan nakala nila ang mga PTB, ang mga may hirap lang yan. Ang mga pang high blood. Kaya sa mga common tao, pwede na rin po yan. No? So, minsan nagkakaroon po ng mga stigma, pero it's not true. No? And then, for the financial, again, hindi na sila nagsa-self-medication na lang sila kasi nga, sabi nga nila, hindi naman din daw ganun kamura ang mga professional fees ng mga doctor, especially if doon po tayo sa mga hospitals, big clinics, no? And of course, advertisement. That's why there are other pharmaceuticals who are using actors, or even TV personality just to promote their products. Potential risk of self-medication. Failure to seek appropriate medical advice promptly. Bakit nga po? Kasi nga po, ayaw na nilang magpakonsulta sa doktor. Ang gusto nila mag-self-medicate na lang. So, because of this, hindi na appropriate or hindi na accurate yung nagiging diagnosis nila. And it has something to do with having your own or incorrect diagnosis and incorrect choice of therapy. Kasi nga po, again, unang-una pa lang, alam mo na, simpleng ubot-sipon lang. Yung pala, PTB na. So, syempre, iba po ang gamot doon. Of course, sa PTB, nandiyan na rin po talaga yung para sa ubo, para sa sipon, kung meron man. But iba pa rin po, in addition, sa simpleng ubot-sipon, ang gamot for anti-TB meds. Now, failure to recognize special pharmacological risks. Since that wala nga po tayong consultation sa doctor and ang ginagamit lang po ng ibang tao ay self-medication, hindi po talaga nila alam ano po ba yung mga probable or ito nga po yung rare but adverse effects, yung mga pwedeng mangyari dun sa gamot na ininom natin. Like, again, i-correlate ko lang. For example, no, dun po sa mga anti-TB drugs. Pwede pong mamulay ihi nila because of the rifampicin. Yun po ay usual po na reaction po. Yun, hindi po siya severe or adverse reaction. Failure to recognize the same active substance that is already being taken under a different name. Common po dito, yung mga anti-cold remedies. If you notice, there are some anti-cold remedies wherein meron silang paracetamol na component. Pero ang ginagawa po ng iba, umiinom pa sila ng separate na paracetamol for the fever. Actually, kung tutuusin, pwede pong yun na lang din na inumin nila para hindi na magdoble-doble ng gamot. Then, failure to report current self-medication to prescribing physician, like double medication or harmful interaction. Kasi nga, since that nag-self-medicate, they really don't know ano na ba talaga yung mga nainom na pareho na po ba yung gamot na iniinom nila o magkaiba pa rin. Kasi nga, hearsay, sinabi, binigay ni kapatid, binigay ni kapitbahay, no? Failure to recognize or report adverse reactions. Because they really don't know na ito pala ay drug reaction na pala or interaction or complication na pala. One of the example here is of course glutathione, in which actually po ang glutathione ay antioxidant. Ang pampaputi effect po niya actually is just a side effect. However, since na maganda naman itong side effect na ito, ginagamit na rin po natin siya na pampaputi. Okay? Incorrect route of administration. So this is common for yung pong mga vaccines, yung pong mga gumagamit ng mga injectable. No? For example, sinabi intramuscular. Ang nagagawa ay subcutaneous. Magkakaiba po kasi yun. Nagkakaiba sila sa angle po ng needle na pagtusok po sa ating katawan. No? Inadequate or excessive dosage. since na, yun nga po, nagkakaroon na po tayo ng self-medication, there are some patient na, basta ito, ininom ko lang, hindi ko alam, meron pala itong 200 milligrams, 400 milligrams. Akala ko basta isang gamot, isa lang preparation. So, yun yung nangyayari. Excessive prolonged use. Akala nga po natin, as long as may nararamdaman, inom lang ng inom. Yung pala, meron lang po tayo dapat na, kumbaga, maximum dose po kung kailan or gaano katagal natin inom yung gamot. This is also in correlation sa sinabi ko kanina is the risk of dependence and abuse. Common po dito yung mga pain relievers. No? For example, we have this frequent headache. So we're just, some people are just taking medications for analgesia kasi ang sakit. Pag masakit, inom. Masakit, inom. What they're not noticing is nagiging dependent na pala sila. Nakadaunting sakit lang, inom na sila ng inom ng anti or analgesia or anti-sakit na gamot, which is dapat hindi po. Food and drug interaction. Ano po ba ang common dito sa food and drug interaction ito? So, minsan, pag halimbawa, uminom tayo ng, di ba minsan sasabihin ng doktor, you have to take this 30 minutes before kakakain. Kasi, pag humilaman ang tiyan, medyo yung pong absorption, medyo naiiba. Or mas maganda po ang absorption niya kung wala naman yan. So, na-explain po ng mabuti through medical consultation as compared to self-medication. Storage in incorrect conditions or beyond recommended shelf life. An example here are the drugs or medications which are stored in the amber-colored bottles. Why? These are used para po to protect from the sunlight. Di ba, for example, di naman tayo bumibili per bottle. Minsan, bili natin yung what they call as tingi-tingi. So, nilalagay lang po ito in a clear plastic. And tayo naman, not knowing na yung pala yung purpose ng amber bottle colored. So, inaano na lang natin yung amber colored bottles. Yung pala yung protekta lang sa sunlight. So, halimbawa, iniwan lang natin yung gamot sa table, naaarawan. Bumababa na po yung efficacy ng gamot. Okay? And there's also this increase in drug-induced disease. So, common po dito yung mga antibiotic or the antimicrobial. Paano po yun? For example, ako, common naman, alam ko mga amoxicillin. May sugat ako sa paa, iinumin ko ang amoxicillin. However, amoxicillin is not really good for mga sugat po. Ito, common pag mga upper respiratory tract. Pero pag mga sugat-sugat, medyo hindi po effective si amoxicillin. Okay? Wasteful public expenditure. So, yun na nga po. Since na nagpunta yung isang tao, gumamit ng amoxicillin sa sugat, hindi nga po yun appropriate. So, magbibigay ulit si doctor na additional, so gagastos na naman po tayo. So, yun po yung sinasabi natin na doble-doble po gastos. Okay? Now, after knowing all this or explaining to you self-medication versus medical consultation, ano po yung pros and cons niya, we now apply this to hypertension and diabetes mellitus. But I'm just going to give you parang kunting what is hypertension and diabetes all about. Of course, when you say hypertension, this is the blood pressure level of more than 130 over 90 millimeter mercury at different occasions and at different times. For the normal blood pressure, ranging to 90 to 120 over 60 to 79 millimeter mercury. For the borderline naman po, 121 to 139 over 80 to 89 millimeter mercury. And lastly, hypertensive na po ang tao kung ang blood pressure niya ay parati pong nasa more than 140 over 90 millimeter mercury. Now, for the diabetes mellitus, this is elevation of the blood sugar level. Yung blood sugar level po natin, we could get this in two different ways, no? Yung isa po is what we call as the fasting blood sugar, wherein there's no food or water for 8 hours before po tayo kuhaan ng blood sample. And then the random blood sugar is we could get the blood sugar level any time of the day. For the normal value, for the fasting blood sugar, FBS, we have 70 to 99 mg per deciliter, and the random blood sugar of less than 140 mg per deciliter. For the impaired fasting plasma, it's 100 to 125 mg per deciliter. And for the RDS, 140 to 199 mg per deciliter. Diabetes mellitus naman po ay 126 and above and 200 and above for the random blood sugar. So when we say impaired fasting plasma, hindi po ito yung normal na blood sugar. However, elevated po siya to the point na hindi rin naman po siya diabetic. So nasa gitna po siya. Now, having known this, what are the common self-medicating practices of people with hypertension and diabetes mellitus? Common po dito, unang-una na, taking of garlic as remedy to lower their blood sugar, or the blood pressure. Common po ang garlic talaga po. Ito po dapat ay pagpapababa po ng cholesterol level and not really the blood pressure. Although probably indirectly yes, pero hindi po talaga siya pagpababa ng blood pressure. Another is the taking of ampalaya, guyaban, etc. other leaves or fruits just to lower the blood sugar level. Pwede rin in a way, but indirectly po. Hindi po talaga pwede na ampalaya and guyabano lang okay na and without medications. No? Taking of same medications like what their other family members are taking. Ang common po dito, minsan yun sa mga high blood, there are other etiologies or reason why nag-high blood ang isang tao. Pwedeng dahil mabilis ang tibok ng puso niya. Or pwede rin naman po na dahil kumikitid po ang kanyang ugat. Yun po yung mga dahilan. That's why siyempre, kung mabilis po yung heart rate mo, bibigyan ka ng pabagal ng heart rate. Kung dahil naman po sa medyo makipot na po yung ating arteries or ugat, siyempre pampaluwag or pampadilate naman po ang ibibigay. So hindi siya para-pareho. Hindi ho yung gamot ni tatay or ni tatay ay po pwede ko rin pong maging gamot. So that's the reason why we have to really consult a medical practitioner. Taking medications as needed only and not as maintenance medication. Ito po minsan ang medyo talagang problematic. Kasi sasabihin nila, ay, tinigil ko na po ang aking gamot. Bakit nyo naman tinigil? Sinabi po ba ng doktor? Hindi. Okay na kasi ako, kontrolado na. Not knowing na kaya po siya control is just because meron kang gamot eh. But once na niremove niyo po ang gamot, ayan, maybe to some people, mga after 1 week, 2 weeks, okay pa yung kanilang blood level ng blood pressure or blood sugar. However, after po dun sa certain number na ba, 3 weeks na, nawawala na effect ng gamot. So, nagsisimula na rin pong bumaba or tumaas ang kanilang blood sugar level at saka ang blood pressure. Now, what are the potential risks of self-medication by patients with illnesses like diabetes and hypertension? Of course, since na mali nga po through self-medication ang ating ginagawa, nagkakaroon po tayo ngayon ng uncontrolled reading ng blood sugar level and the blood pressure level. Either mataas or mababa masyado. This may also cause other drug interactions. Common dito for hypertensive people, yung pong using or taking of decongestants. Kasi there are some decongestants that are really notorious to increase the blood pressure more. So, hindi po talaga dapat basta-basta tayo nagbibigay ng mga gamot or nagsa-self-medicate. Okay? And of course, it could also lead to more complications. Like for the hypertension, actually hypertension diabetes, more or less pare-pareho sila. Pareho silang nagkakaroon ng stroke, kidney problem, heart attack. No? However, with the diabetes, mas marami kasi siya. Sa diabetes, nagkakaroon na tayo ng blindness or to the point na talagang super labo na talaga yung mata natin. Nagkakaroon din po tayo even simple dental problem could also be caused by uncontrolled blood sugar. And because of the nerve damage also na nangyayari, nagkakaroon na tayo ng amputation. And of course, ang medyo big factor po, especially sa lalaki, is the sexual dysfunction. Okay? And lastly, ito po ang hindi pinakamagandang adverse complication po ng ating minsan na pagsa-self-medicate. And this is, it could lead to premature death. Now, to establish steps in preventing potential risks with self-medication, tatlo po ito. Information, therapeutic advice, and education. Ano yun? Information, of course, we have to tell or dapat kasi alam ng pasyente ano ba yung tawag na pathophysiology ng sakit mo. Ano ba talaga yung sakit mo? Ano ba ang high blood? Ano ba ang diabetes mellitus? We really have to know ano ba itong sakit na to for us to know kung paano natin i-manage. Next is the therapeutic advice. So, since knowing ano yung cause ng ating sakit, malalaman na rin po natin ano yung tama or appropriate na gamot or the therapy na kailangan. Kasama na po dito yung dosaging, frequency, gaano katagal iinumin, and so forth. And lastly, the education. Again, ang importante po kasi ng sinasabi namin na medical consultation, nandun po kasi yung professional background ng doktor or meaning pinag-aralan po. So, dapat po sasabihin din sa inyo, as compared to the self-medication, at least pwede tayong magtanong, the pros and cons, and the complications and all. But then again, the doctor must also explain it on the level na maintindihan naman din ng pasyente. Hindi yung mag-explain nga tayo, pero ang gagamitin naman natin mga highfalutin words or yung mga medically inclined terms. Medyo mahihirapan na sa pasyente. So, yun naman po yung kahalagahan din ng ating education. Okay? So, I just hope that nakatulong po talaga yung differentiation natin or the benefits or the pros and cons of self-medication against medical consultation, in which we also correlate this with the high blood or hypertension and diabetes mellitus. Now, if you really want to know more about hypertension and diabetes mellitus as well, you could always follow the Sugar Beat PH or just follow their Facebook page. No? Meron po silang Friday-Serye. Thank you very much.
Thank you to our guest speaker for providing with us another informative virtual session here in Sugar Beat. For more informations like this, please like and subscribe to Sugar Beat social media platforms. You can find us on Facebook, Instagram, and YouTube. Do you have a question about diabetes and hypertension? Our chatbot is ready at your service. Please send us a message on our Facebook page Messenger and we'll try our best to give you the answers. Once again, thank you for joining and see you again on our next program.